Let's talk about fasting. So fasting is important because it's not only about what we eat, it's also about when we eat. And so if we're careful about choosing when we eat and when not to eat, we're going to provide a lot of extra benefits to the body. When we look at research on fasting, we know that fasting reduces inflammation, lowers blood sugar, reduces cholesterol, lowers blood. I have lowers blood sugar twice, but it's that important. It lowers blood sugar and improve metabolic function. I also failed to mention that it lowers blood pressure. That one of those lower blood sugars should have said lower blood pressure. So it has a lot of benefits. We want to make sure we're doing it the right way. And so when we're talking about fasting, fasting begins the moment you take your last bite of food. About 4 to 6 hours after fasting, all your food has left your stomach. Blood sugar begins to go down to normal, and insulin is no longer being produced. After about 10 to 12 hours, all the food that's been consumed has been used up for energy. The digestive system is mostly inactive, and the body has shifted into healing mode. When we reach about 14 to 16 hours of fasting, the body is converting stored fat into energy. So this can be an important tool for weight loss if you need to lose weight. After about 24 hours, autophagy has started, and autophagy is a process whereby our healthy cells are recycling waste products for energy. And so this is a very efficient process once we have autophagy kicking in. Glycogen stores are used up at that 24-hour mark, and glycogen is basically stored sugar, which we have as a ready source of energy. And we're able to really tap into all of our body's reserves of energy, whether it's glycogen or fat at this point. At 36 hours, autophagy is still happening at an even higher rate. At 48 hours of fasting, the immune system actually resets and regenerates, and we see a substantial reduction in inflammation. And at 72 hours of fasting, we've maxed out autophagy. So the big question then is, how long should you fast? I really think this is an individualized thing. An optimal fasting schedule should be based on your own unique needs. We certainly want to extend the fast long enough to obtain benefits, but we don't want to extend the fast for so long that we're starting to feel poorly or have any detrimental effects. So we're going to talk about types of fasting, and intermittent fasting is my favorite method of fasting. And quite simply, intermittent fasting involves alternating periods of fasting with periods of food consumption. And this is a really flexible approach. It can be tailored to your own unique needs in terms of your lifestyle. And there's two main types of intermittent fasting. The first is called time-restricted eating. You may sometimes see this referred to as time-restricted feeding. And there's also another type called block fasting. So we talk about time-restricted eating. It's restricting your eating time. Sometimes you'll hear this called an eating window to a certain portion of the day. So within a 24-hour period, you can do what's known as a 16-8. So 16 hours of fasting with your eating condensed into an 8-hour window. You can do 18-6, which is an 18-hour fast with 6 hours eating window. Even something like 24, which is a 20-hour fast with a 4-hour eating window. And you don't have to do this every day. You can just do it certain days of the week. I do recommend doing it at least 5 days a week. You can do it every day if you want to. It's not harmful. But using sort of the 16-8 example, if you're wanting to do a 16-hour fast, you would basically start eating every day around noon, and your eating window would extend until about 8 p.m. And then you'd start your fast again. You'd finish eating by 8, and then you'd fast from 8 o'clock at night all the way until noon the next day, giving you a 16-hour fast. And the key with this approach, as well as with any kind of fast, is just make sure you're still making healthy dietary choices. The temptation here for some people is to take more liberties and not eat a very healthy diet because they're not eating throughout the day. So they kind of tend to binge a little bit more. So still make good choices, but if you're condensing the eating and extending that fasting window, you're going to get a lot of good benefit from that. Block fasting involves breaking down the fast into days of the week as opposed to hours of the day. So a 5-2 block fasting would mean you're eating normally for 5 days a week, and you have 2 days a week 2 consecutive days where you're fasting. So it's a 48-hour fast you're doing. Another option is a 6-1 where you're eating normally for 6 days of the week, and then you take 1 day of the week to fast. You can even think about it in terms of a monthly schedule where you're eating normally for 28 days, and then you fast for 3 days in a row. So if a 31-day month, 28 days straight of eating normally, 3-day fast. And there are certainly long-term fasts as well. These are fasts that are extending for many consecutive days or even months. There are extreme fasts that people have done for many months with obviously some impressive results. But these long-term fasts can have some really significant potential risks as well. So this is the kind of thing to only do under the supervision of a physician with extensive training, managing patients for long-term fasts. This is not something you want to do on your own. I personally don't use any long-term fasting with my patients, but I do acknowledge that they can have value in some circumstances, but not necessarily for cancer. But for other health conditions, I think they can be valuable, but they have to be done with great care. So some fasting pros and cons. I think time-restricted eating has the advantage of being easier physically and mentally than block fasting when you're fasting for days at a time. Block fasting does extend the fasting window. So there are going to be some additional benefits you get with block fasting that you don't get with time-restricted eating. Again, long-term fasting can be used in certain circumstances, but needs to be carefully supervised by a physician. Listen to your body. If you do decide to start fasting, listen to your body. Some people are going to need to ease into it more than others. So if you're trying to go from starting your daily eating at 8 a.m., you're trying to extend that to noon, you may not want to jump straight to noon from one day to the next. You may want to just maybe increase your fasting window by an hour or so, and then gradually work up to starting your eating at noon every day. And then the other important thing to note is you are going to feel hungry. You're going to feel hungry as you get used to fasting. You might be a little irritable. You may have a little bit of a headache or some brain fog. That's normal. I have found that electrolyte supplementation can be helpful. Many times those symptoms from fasting are not due to lack of calories, they're due to lack of electrolytes. And so certainly, since we're avoiding calories, we'll want to find an electrolyte solution that is non-caloric. And there are plenty of those out there that are just basically electrolytes, and sometimes they need to have a sweetener. So there's some electrolyte formulations that contain stevia and some natural flavoring. So it's almost like you're drinking Kool-Aid, but it's nothing harmful, and there's no calories, so it doesn't break your fast. That's a really good option for people who do find that they're symptomatic with fasting. But listen to your body for sure. There are also what I call pseudo fasts, which are fast in quotes, because they're not true fast in that they do provide calories, but it's still low calorie. And so you've heard of juice fasting or broth fasting. These are examples of pseudo fasts because they are not actual fast, but they are promoting a lot of the benefits that we get from fasting. I don't think these are as good as real fasts, but if they allow you to extend your fasting window longer, then I think they have value. And certainly they're better than nothing. So something to consider if regular fasting isn't an option for you. So frequently asked questions with fasting, the most common question is fasting starvation? No, it's not. When it's done properly, fasting, I think, is a very healthy way to eat. I mean, if we look at, many generations ago, food wasn't readily available. The body was created to go long periods of time without food when there weren't grocery stores and well-stocked pantries in our homes. And so the body's able to tolerate a fast and is designed to fast. We certainly know there are a lot of religious reasons for fasting. And so I think it's really cool that the science is now showing us that there are physiological and biochemical benefits of fasting as well, not just spiritual. And so it's really neat to see all the research that's been done on fasting in recent years. But it is not starvation. Another question is, will fasting slow the metabolism? There's no evidence that occurs. There's actually evidence that it improves metabolic health. Sometimes that's the jump start people need to really start losing weight and having a more efficient metabolism. And then the obvious big question is fasting safe? Absolutely, the answer is yes, when it's done properly. So again, I don't recommend fasting for people who are trying to become pregnant or who are pregnant. Diabetics that take certain medications should be really careful with fasting. Again, that's a question to ask your doctor. If you have history of an eating disorder, I would also be careful, just because I wouldn't want fasting to stimulate any sort of return to dysfunctional eating. And if you're underweight, certainly be careful with fasting, because many people will tend to eat less when they're fasting, and so we don't want to cause weight loss. So we want to be careful if you're underweight. But otherwise, I think fasting is very healthy for most people.